Hello, my name is Michelle Roman, and today I'm going to present a PowerPoint on access to the electronic health record. This PowerPoint was made for the Digital and Information Literacy for Nurses online course at Upstate. So what does having access to your electronic medical record mean? Well, patients actually have the right to see and obtain a copy of their medical records. And this is under the Health Insurance Portability and Accountability Act, or HIPAA. So, because of this law, patients have the right to review their medical records, with the exception of any psychiatric notes. And according to Rappaport 2015, a small study suggests that when a patient accesses medical information, it puts treatment in perspective and eases the patient's anxiety and confusion because they know what's going on. They have access to their lab results. They have access to their medication list. They can actually do some research if need be. And currently, if an organization provides information through patient portal, they have 4 days to provide access after the request is made. If the organization does not have patient portal, this request can take as long as 30 days. So the facility has as long as 30 days to give you your copy of your medical record. Now, patient portal is an electronic way to actually access your information. So I'll talk about that on the next slide. So in my opinion, all facilities should provide patient portal and look in a location where the information can be accessed as soon as it becomes available. Not wait 30 days, as I mentioned above. But patient portal is the convenient access to your health information through the internet. So what is an electronic health record? I'm going to play this video now. This is from North Shore Health Systems, and it talks about the functionality of an electronic health record. So how does access to your electronic health record work? The first step is to access a authorization form, and you fill this out at the facility that you're being treated. Then you research what information that you need. If you want to need lab result, if you're going for a second opinion, for example, you'll need lab results, an H&P, or whatever information. You just have to know what you need so that you can request it. You don't want to request everything because it might just be information overload. Next is some information continues to be confidential and will not be released. And again, this is the psychiatric notes that usually are not released. Also, there may be a charge for medical records, and it is actually a law that allows a facility to charge a fee for records, and they can charge as much as per page of your record. And then last is if you see any information or inaccurate information on your chart, you have the right to request a change at the facility that the error was made. So when is it used? An electronic health record is used anytime a patient desires access to their medical record. It includes direct access to the H&P notes, reports from consultative specialties. So if you are sent from the general doctor to a nephrologist or an obstetrician, all these reports would be in one place. Operative notes, test results, medication list, and discharge summary. And I'm going to share a few statistics from the Office of the National Coordinator for Health Information Technology. 1 in 3 people, and this was a study they did, 1 in 3 people experienced information gaps. That just means that the information they needed, there was just time between or not enough information for these people. 3 in 10 were offered access to their online medical record in the study, and of those offered, half viewed their information at least once a year. So that if 3 out of 10, so maybe 1.5 of them viewed their information at least every year. And the majority of those who actually accessed their online medical record in the last year, they reported the information as being very helpful. So from these statistics, I can see that people are not choosing to access their health record, even though the advantages are so many. So who is it intended for? The electronic health record is intended for anyone who uses the healthcare system. And what are the advantages to accessing your electronic health record while being treated? Well, it keeps an accurate, up-to-date health record. So, the medication list that we used to do, paper, we used to write them out. This keeps an up-to-date list for those with multiple medications. Next is it helps clinicians find errors and increases patient satisfaction. So if the clinicians go over things found in the chart, the patient can also find errors when they review the chart, and it just helps make a patient happier because they feel in control. There's real-time release of lab tests, radiologic tests, and other time-sensitive material. No more waiting months to follow up with the physician. You can have test results and radiologic test results to kind of look into. It increases patient empowerment. That goes without saying. We're in control of our chart. We're doing research. We just are better involved that way. Next is different specialties involved in patient care all have the same data. And it just goes without saying, everything is in one place, neatly packed, and any specialty that you see can just pull up that data with the click of a mouse and have all your information. Information is also organized as it becomes available. So no more crossing out your medication list, no more having to figure out when you had surgeries. I mean, everything, all of your information is there. Also, a big one is no more unreadable print from doctors. You know, sometimes they give us a prescription with instructions, and then we get home and look at that prescription and wonder what it says. I know I've had to call back to the doctor's office when I've had to clarify. And then also it prevents repetition in tests or labs. So if you are seeing multiple specialties and they both order a CBC to check, both of them are checking different things, that can be easily detected if they looked at your your electronic health record. So some disadvantages to accessing your electronic health record also exist. The first one I would talk about is nurses believe that if patients had access to their electronic health information while being treated, their workload would be increased. Well, this is actually a false belief, because there has been a study done and it actually does not increase the workload as we thought. Also, possible increase of worry and confusion in patients. You know, we're worried that patient overload. Patients are looking at every number of lab result or every test, every word, and it just might confuse the patient. Also, HIPAA allows providers to charge patients a reasonable cost-based fee for providing paper or electronic copies of medical records. Again, they can charge whatever they kind of feel like, but they have to go and it's got to be like what they a fee for their time and their materials, and so they can actually charge whatever they want. Also, the cost to the facility to upgrade the electronic health record to an electronic health record system, and also patient portals. Also, possibility of data corruption with viruses. That's a big one. Or unwanted exposure to secure and personal information. That's a big disadvantage. You know, there's always, you know, according to a lot of research we've done in this class, there's a lot of people wanting to do bad and get personal information. So that's a big one. And I'm going to talk about this young man. His name is Stephen Keating. He actually was a medical student, and he monitored his health record. He was having an issue, and they had to do a CT of his brain, and it revealed that it was slightly abnormal, but the doctors reassured him that was nothing to worry about. So he continued to follow up with these doctors and keep all his information in one place and do research. And one day he noticed that his smell, he kept smelling whiffs of vinegar. And actually, according to his research that he did, they might have been small seizures. So he actually pushed doctors into performing an MRI, which actually saved his life. So, you know, he knew what to ask for, and, you know, he got these doctors to actually move on what his gut feeling was telling him. So this picture right here is a scan of or a copy of the actual tumor that was removed from his brain. that actually saved his life because he was so involved in his own treatment and care, and he kept a tight watchful eye on his medical record, so it actually saved his life. Patients need to feel empowered with regards to their health. In order to accomplish this, access to their electronic medical record is essential. According to the Office of the National Coordinator for Health Information Technology, all patients do not take advantage of this option. Again, not everyone is looking to go into their medical record, but those that do find it very helpful. The access to their electronic health record puts them in control and allows monitoring of their health information. Again, if multiple specialties are involved, the electronic health record pulls everything to one place, so it's easily accessible for all.